I want to set out our plan for managing COVID this autumn and winter, and I want you to cast your mind back exactly a year and think where we were last September as schools went back and the colder months approached, because in one way our position today is actually more challenging. We have higher levels of daily cases, thousands more, but in many other crucial respects, the British people, all of us collectively and individually, are incomparably better placed to fight the disease. We have more than 80% of all over 16s now double jabbed, double vaccinated, and we have COVID antibodies in around 90% of the adult population. And those vaccines are working. In essence, we're going to keep going. We will continue to offer testing, and we'll continue to urge everyone to be sensible, to be responsible, wash your hands, use ventilation, consider wearing a face covering in crowded places with people that you don't know, stay at home if you feel unwell, download and use the app, and we're investing massively in our NHS to meet the pressures of COVID. We're helping to vaccinate the world with 100 million doses for developing countries by next June. And I think this country should be proud, continue to be very proud, that the Oxford AstraZeneca vaccine remains the workhorse of global immunisation. And we will keep further measures in reserve. Plan B. We do not see the need now to proceed, for instance, with mandatory certification, but will continue to work with the many businesses that are getting ready such a scheme. Indeed, over 200 events have already used COVID certification voluntarily. And it's just not sensible to rule out completely this kind of option now, when we must face the fact that it might still make the difference between keeping businesses open at full capacity or not. We will also keep open the option of mandating face coverings as they have elsewhere, or advising people again to work from home, reflecting the fact that when you've got a large proportion of the country, as we have now, with immunity, then smaller changes can make a bigger difference.
We want to get vaccines out all around the world, including low-income countries. That is an absolute moral imperative. It is also an absolute practical imperative for everybody, and everybody agrees with that. That isn't a contentious point. The second question is there some waning of immunity that means that a third dose, a booster dose, is a sensible thing to do? And I think there is now reasonably good evidence that that is the case. The UK has taken, in a sense, a middle way on this, led by the JCVI. It has neither said no boosters at all, because there is evidence of waning, particularly at the top end of the age range and in those who've got pre-existing health conditions. And those are the groups that JCVI have actually recommended it, in addition to health and social care workers, because of the chance that this is going to reduce the probability they will infect others. So there's a very good logic, but they've not gone all the way of recommending universal boosters for everybody. So